Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk some more about mouth breathing. This is something that everybody, many people have this problem, and there are different amounts of it in each one of them, so there's a different response to mouth breathing. And the way you use your tongue and stuff like that has an effect on the facial structure. For a long time there, I would, excuse me, I would talk about mouth breathing, and I would just bring up these 4 things that happen in mouth breathing. I mean, when we breathe through our nose, we filter the air. It goes past the turbinates, and they have those little fine hair-like structures over the turbinates, and that gathers up the major part of the dust and the dirt and things that float through the air. I remember when I was a younger man, we were working in the hay field, and we had a lot of dust from the hay and everything, and you'd go outside and spit or blow your nose, and you'd have all kind of crud come off of your turbinates into your handkerchief or whatever you blew your nose into, and that was just something that we had to deal with. And when you would get in there where the dust was really bad, you just kept your mouth closed as much as you could, and then we'd go over to where it was clear and breathe several times and kind of cleared it up, and you'd spit this stuff out, or else you swallowed it, or if you would breathe through your mouth, you would suck it down into your lungs, and then that's a real problem. I had a child once with a patient of mine, and I was working on him, and he was a mouth breather, and he was being treated by some lung doctor for his lung problem he had. And we expanded his palate and fixed it where he could breathe through his nose good, and his lung problem went away. And so this is one of the things. So in mouth breathing, we were teaching the mouth filters the air, one thing. It filters it out, as we just got through talking about. It moistens the air up to the same moisture like your body has. Your mouth does not dry, your nose and the turbinates does not dry out. They stay moist where you breathe through the mouth in about 15 minutes. You'll have a dry tongue and dry thing, and you'll be sucking stuff down into your lungs that way. And so there's a whole bunch of things that it affects the way you breathe through there. You take a child who's breathing through the mouth, and you don't have to breathe as hard just sitting around breathing through it. You kind of breathe slow, and the air goes into your lungs slower, and it doesn't go out into the alveoli as good as when you have to breathe a little bit and suck it in faster, and then it goes out into the alveoli better, and your blood oxygen changes to some extent simply from breathing through the mouth and breathing through the nose. Now realize that when you run or you get out and really exercise or do any real exercise problem, you have to breathe more. You need more oxygen, and so you breathe through your mouth, and you suck a lot of junk into your lungs if you're in an area that's dusty and dirty like that. You get it down into your lungs, and you have a problem. So this is another thing. Now, if you breathe through your mouth, your tongue has to be in the bottom arch, and you will develop, you will bring cross bites, and it will develop. The maxilla won't develop properly, but the lower jaw will develop more. I think we've got somebody on here that will show that and illustrate. Breathing through the mouth causes these problems. Now this is an older guy. He's an engineer, and he is a chronic mouth breather. And you see how narrow these arches are right here. Let me get a little pen here, and we'll show that. Now you see this is narrow this way, and you look at the guy, and you see he's biting. His upper teeth are inside the lower teeth. On that side, he's pushing his tongue out wrong. He should have gone to a dentist that knew how to correct this. And both sides of his mouth are in crossbite. This is crossbite. This is over here crossbite. You squeeze them together. The tongue pushes these teeth out. If you spread this out, it'll pull this in to some extent. So we took this guy and we put a palatal separator and get this, open that up wide enough, and it's locked onto these teeth, and it brings them out, and that opens up an area where the terminates are and makes bigger space in there. Even if you're allergic to things and your terminates are swelling up, if you spread it out and get it big enough, they can swell a little bit and still not cause you to have to breathe through your mouth. So this is what happens with this guy. This is 06 working on it. You can look at inside, from the inside out. You see these teeth are fitting way over, and these are out further on the bottom. It should be the other way around. The upper one should be fitting over this like that, with the cusp coming in here, and that's the way it should fit, but it isn't. And now his tongue didn't have room enough in here, so when these teeth came through, it pushed it forward, making a little different room, and you need to correct the real problem. And that's what we call our stuff straight, wise, smart. Go straight to the problem that's causing the work, or the several problems that causes the problem that the teeth are developing. So that's why we call it straight wise, in other words. All right, now I took this guy and measured the models when we were starting off, and I put the inside of these baby teeth like that and measured, and this went over that far. It was very narrow. Now we took some of it and we widened this out. That's the same thing, and I took that and put it in. Now the needle goes all the way around here. This is that much broader, and we carried the teeth out parallel. We didn't just lean them out this way. If you do that, sometimes you even narrow the airway when you spread the molars this way. So you got to bring them bodily out. And if you go bodily out with this, and you put it over here, you open up a gape, you close that, it brings your upper teeth back again to some extent. And so that is what we did with this young man who was an engineer, and he had a breathing problem. I knew a physician, a good friend of mine, and I told him I can fix this, and he was like that. I can go in and spread your palate without doing any surgery on you at all and correct the problem he has. And so we took this guy, spread it out. Now you see the teeth are over on the right side, and the teeth are lined up. These teeth are together, and we finished him like that. I don't think I've got a finishing where we took the braces off. But you can look at this arch here, and then you remember how the arch was back there. And the lower teeth, I didn't try to squeeze them down at all. I just spread his upper far enough, and he opened his airway up, and he could breathe better, and he did that. And here is the fella that we had when we started. And we straightened those teeth out. I don't know whether it's show teeth. Yeah, we brought these teeth out, lined them up, got them over, and it corrected the front part at the same time. When we spread that, it brought it back like that, and we lined the lower teeth up better and made them fit together. Now this is mouth breathing causes all kinds of problems. And it affects people who they don't swallow properly. And if you don't swallow properly and you have an infantile swallow pattern, you can swallow like that, like an infant does, and not bite, and your teeth don't get this constant pressure every time you swallow. They bite together, and that determines the height of the face out here from the under the nose down to the chin. And you give somebody an added half-inch length in there, and their facial looks, it makes them look kind of stupid. And mouth breathers aren't as a chronic mouth breather doesn't really get the same oxygen to their brain, and that's why you really need to do this. And so that appears, and the person just looks like here. This is a bad picture right here. This coming in on that side, and anyway, we finished the guy out with his teeth like that, and when we started, they were much more narrow. And so this helps all this. It helps his breathing, it helps the blood oxygen level, it filters all this air, it keeps it moist, even though your mouth may dry out real quick, and your mouth, when you've got a lot of moisture in your mouth, it has some filtering ability. It absorbs it on the skin and stuff in the mouth, and then you either swallow it or spit it out, and that helps. You can swallow junk like that, and it doesn't normally affect you unless you've got some bad bacteria in it, everything. So I hope you understand the importance of breathing through the nose. Mouth breathing creates not only problems with the lungs, the blood oxygen, the facial development, there's everything. It messes up the set of teeth by breathing through the mouth. And when Dr. Harville treated those monkeys, every one of them had some malocclusion problem, which monkeys never have if they're allowed to breathe properly. So I will sign off and we'll close out, but I hope you'll watch our videos, and we're soon going to have 1,000 videos here if I live long enough, and that is going to help people. When I went to the people in the orthodontic department years ago and tried to get them to teach general dentists and everybody orthodontics, they said, we're not going to do that. And so people grow up and their dentists don't know what can be done orthodontically. It would help, there would be more orthodontics to be done if people understood it. And they ought to be teaching it in dental schools now. Don't just bore them to death with a bunch of cephalometric stuff. That's what they did to our class. And then I just got out, and I had kinfolks. My uncle taught orthodontics, and my mother worked for one, and I sat and watched him. And that's one reason that I went into orthodontics. It is such a gratifying profession, and it makes me feel good to be able to help people out with this problem that they have during life. So I'm going to say goodbye, and I hope you'll watch our channel now.